The Erie County Health Department says it has detected one case of measles here in Erie County.
Officials are working to spread the word quickly to try and keep a check on the disease. Dr. Mark Hicar is an infectious disease specialist at Golisano Children's Hospital of Buffalo. I'm sure there's quite a few people out there, quite a few parents who are hearing this and are concerned. So what information is out there that people should really know about this?
Yeah, well, mostly we're a pretty well-vaccinated area, so you shouldn't be too concerned if you have good immunity and most everyone in your household is vaccinated. Now, there are pockets of, particularly for young kids, particularly under 1 year of age, they don't get vaccinated, or people who are immunocompromised, or pregnant women are at risk, basically. So if you are in an area where, or if you're in a family that has those people, you want to make sure everyone around them is up to date on their vaccines.
Could you talk about the contract casing, all that, how that works within Erie County? Yeah,
so what happens is, we know where at least this individual that was infected was in our children's hospital twice and in an outpatient clinic once. And measles hangs in the air. It's one of the most infectious viruses in the world, so you might see a thing about in 2 hours after the time period. That 2 hours means it was hanging in the air and you can still catch it basically if you're not immunized. So that's why these time periods are fairly long, because they were in the emergency room in two different events and also in this clinic. And so what that means is mostly the Erie County has reached out to the clinics, reached out to the hospital and said who's in your facility at that time period. They have built a list, but that is not all encompassing. Somebody might have come in and out to visit or to deliver something into these areas. So if you haven't already been contacted by Erie County and are reviewing those time periods and those locations and you think you're involved, you should reach out to Erie County.
This is the first case in Erie County in quite a few years at this point. And one of the things that we do know from the release that we received from the health department is that it wasn't contacted locally.
Yes.
So could that give people kind of an ease of mind that it's not something that is widespread?
Right, yeah, I mean, so in the past year we've had U.S. transmissive cases in Texas, and then it moved over to New Mexico, and then Utah, and actually right now in Virginia there's over 70 cases in the last few weeks. Mm-hmm. So there are pockets in America that have taken hold in poor vaccination areas. However, this case was not transmitted anywhere from around here. They went to a country that has an endemic infection of measles, where basically measles is being transmitted throughout the year. And so that's where they picked it up, and we know that from the time period of travel and things like that.
Mm-hmm. And when you look at the symptoms of the measles, some of the overlap symptoms may be confused maybe with like the common cold for some families.
Yeah.
What are some of the serious warning signs that someone may be affected by the measles? Yeah,
usually, so it does cause runny nose and can cause red eyes and goopy eyes and cause fevers. Usually the fevers are higher in the 104 to 105 range. Usually the cough, when they have a cough, or they usually have a cough and it's fairly harsh. And so those would be the warning signs. You don't usually get the rash of measles. You don't get the rash of measles until 4 days after all that starts. Unfortunately, you're kind of infectious during that period. So that's why it's such an infectious virus. It hangs in the air long, and it also basically looks fairly similar to a common cold, so you don't realize you have it, but you're walking around and exposing a lot of people. And then the rash comes, and you're still infectious for another 4 days after the rash, but it's a little more obvious when the cases have the rash.
Now, obviously, the biggest way to prevent the measles is through vaccination, correct?
Yes, definitely. Yeah, so, if you're, in this area, we've only had one case. If it's the unfortunate circumstance that it spreads more and we start getting more cases, the Erie County Department of Health will start kind of saying you might want to get your down to 6 months of age infants vaccinated. I don't anticipate that happening. We have enough of a vaccination rate where I think we're going to have only, if any, a few more cases, but probably like in 2018, I think there was one case who came in and we didn't get any spread.
All right, Doctor, good information there, good insight on a developing situation here in Erie County with a case of measles being detected.
Yeah.
Thank you for your time.
You're welcome. Hopefully I don't have to come back.
Let's hope so.
Or at least under better circumstances.
Yeah.